My name is Dr. Rose M. I'm a guidance and counseling consultant, and thank you for choosing to watch the Save Happy Life channel, where matters counseling, psychology, and parenting are discussed. Today, we are going to talk about psychological and emotional impact of dementia. What is dementia? Simply put, in layman's language, dementia is forgetfulness. Dementia is inability to recall. Dementia is memory loss due to changes in the brain. I come from a family that is genetically predisposed to dementia, and thus I have witnessed firsthand the onset of the disease, its progression, and the unfortunate end. Not once, but twice. So when I talk about dementia, this is a topic that is close to my heart, a topic that I have lived through and experienced at a very, very personal level. Dementia is pretty common in the community. I have seen dementia incapacitated formerly very productive senior citizens in my village. I can count up to 10 of them within a walking distance of my home area. I see clips and pictures in the social media and mainstream media as announcements being placed by families looking for their loved one who is a dementia patient, who may have wandered away from home and nobody knows where they are or where they went. Chances are that you too have a recollection of somebody who has suffered dementia. And thus, the critical need for these 2 sessions that we shall dedicate to this topic. Dementia is a common name that is used to refer to the condition where a person has challenges recalling, where somebody has challenges with memory, where somebody has suffered or is suffering memory loss. There are many types of dementia, and the most common is the Alzheimer's disease, which is occasioned or caused by death of brain cells. It is responsible for up to 60 or 70% of the dementia cases that human beings suffer. Thus, it is the most common. We have others that are quite common. For example, the vascular dementia, which is the second most common, and it normally occurs after somebody has suffered a stroke. Others include Lewy body dementia and frontotemporal dementia, among others. There could be 10 or more types of dementia. Some of dementia types are genetic, which means a child has up to 50% chance of picking dementia from a parent. Dementia affects the memory, the language, and decision-making parts of the brain, thus leading to the symptoms that we see. And we're going to look at some common cognitive symptoms of dementia. I have listed a few, basically 10 of them. The first one is memory loss. So much in a way that a person is unable to function normally. Initially, a person may realize that they are having a challenge with their memory before the disease progresses to the later degenerative stages. Other people may also notice that so-and-so is forgetting rather too much. This may be seen in forgetting names of close relatives, forgetting names of children, forgetting names of places. This is the memory loss symptom. The other one is lack of initiative to perform the basic tasks, such as taking a shower, such as telling oneself it's time to prepare dinner. They lack initiative to do those basic tasks which there before they were doing without any prompting. Number 3, forgetting where somebody placed something, where they placed some money, where they placed some keys, where they placed any item, they totally forget. The other symptom is language use issues, having language issues where a person struggles to get the proper words and inability to think clearly. They get stuck in the middle of a sentence and the brain interchanges words. For example, they may refer to a rope as a string, the tires or wheels of a vehicle as legs, etc. You can see there is a connection, there is a relation, but the brain is unable to pin the correct word. They also get trouble doing spellings correctly while they are writing. Number 5, they have inability or they suffer inability to tell time, day, and place. They cannot tell it's 5 o'clock, they're in place X, or it's during the day, or they're about to go to sleep, or they have just woken up. They just lose themselves in that time, day, and place situation. Number 6, they get lost easily. They're unable to reconnect or remember directions to places. They could be driving along the way and they totally get lost or they forget where they were going. And it is at this point also, those who are not driving, they wander away from their homes and they are unable to get back. Number 7, they have a tendency to repeat the same thing several times. They may ask somebody, "What is your name?" or "What did you say?" Or they keep repeating a story that they have told to the same person. They also experience poor judgment. They get confused when handling issues like money. They cannot count it properly, or they cannot pay their bills appropriately. Number 9, they have decreased organizational and planning skills. And number 10, there is noticeable change in sleeping patterns. This may be occasioned by the mood stabilizer drugs that they may be put on by a doctor, or simply by the time disorientation by the disease. There are some psychological signs of dementia, and these are, I shall talk about 4, heavily loaded by several in between. And A, or the first one, is changes in behavior and personality. A person who was calm and emotionally collected becomes irritable, easily upset, and people wonder what is happening. 2, they become depressed. Depression many times runs along dementia. They become depressed and they are easily agitated. They develop short tempers. They are easily angered. Number 3, they are anxious. They are paranoid. And in some cases, they break down into tears very easily. And 4, and the last one we shall talk about tonight, is that they hallucinate. They keep seeing things, people that other people cannot see, things that are non-existent. And to them, the brain tells them, I can see so and so. But you, when you look at the place they are pointing, there is nobody, there is nothing. So they hallucinate, and this happens quite often, especially as the disease progresses. Have I added value to your knowledge base in this topic of dementia? I'm sure I have. Please share with somebody. Please spread it, because in the next session, we shall discuss more about the disease. And since it is pretty common in the community, I would want this video, these 2 sessions, to reach as many people as possible, so that many people as are suffering the burden of taking care of a patient with dementia can be reached, and they understand the disease, so that it is easy for them to take care of their patient and themselves as caregivers. Thank you very much for watching, and God bless you. Bye-bye.